the hemorrhagic coagulation disorders, let us first define unsa day ng hemorrhage. Now, when we say hemorrhage, this is a form of a severe bleeding in which require na siya og interventions. Now, when we say interventions, pagka nang nanay involvement, litaw ka ng mga transfusion or mga drugs to stop the bleeding or to somehow alleviate the results sa bleeding nimo. So, the hemorrhage may either be a localized bleeding or a generalized bleeding, or it could also be an acquired or a congenital bleeding disorder. Now, unsa man ang localized or generalized? Localized bleeding or your localized hemorrhage refers to a type of bleeding which is gikan lang siya sa isa ka location. Now, it could be a cause of injury, there could be an infection or tumor, or na lang siya isolated blood vessel defect. Again, kung moingon kag localized bleeding, isa lang ang location or ang bleeding ana niya is isa lang ang gigikanan ana niya. Whereas kung moingon ka og generalized bleeding, this refers to a form of bleeding from a multiple sites, could be a spontaneous or a recurring bleeds, or the hemorrhage or this type of bleeding requires now the physical intervention and the transfusion. Now, kung i-compare nimo si generalized o si localized bleeding, si generalized bleeding, no, this could be a good indication na naa kay disorder sa imong primary hemostasis or your secondary hemostasis. Whereas localized bleeding, dili siya dili dayon ka makaingon nga basi naa siya primary hemostasis or secondary hemostasis. I mean, na siya disorder sa primary o sa iyang secondary because localized bleeding could either be just mura kanang effect lang siya. Let's say, for example, kanang gioperahan ka, tas wala siya natarong o sirado sa doctor. So, obviously, mag-leak ang imuhang blood sa imong vessels. Moto nga na kay bleeding. But with generalized, since multiple ang iyahang locations, and it could even be a spontaneous or magbalik-balik ang bleeding, no? Now, that could be a sign na naa na kay problem sa imuhang primary and secondary hemostasis. Now, a disorder of a primary and secondary hemostasis with a generalized bleeding is mo na siya ginatawag na to og coagulopathy. Now, si generalized bleeding na siya, it can exhibit into two ways. Na siya gitawag na to mucocutaneous hemorrhage or the anatomic hemorrhage. Now, unsay difference ni mucocutaneous o ni anatomic hemorrhage? Sa mucocutaneous nimo, that is manifested as bruises or purpura or the purple lesions in your skin which is caused by an extravasated red blood cells. Meaning, kanang mga red blood cells bitaw nga nag-leak padulong dito sa imong padulong sa surface sa imong skin or sa imong tissues. And usually, this mucocutaneous hemorrhage are associated with a thrombocytopenia or a decreased platelet count. There could also be a qualitative platelet disorder, a von Willebrand disease, or some vascular disorders. Whereas, kung maingon pud ka og anatomic hemorrhage, these are seen in acquired or congenital defects, which is secondary hemostasis, or there could be a plasma coagulation factor deficiency sa patient. Now, most of your anatomic hemorrhages are internal, like bleeds padulong sa imong joints, sa imong body cavities, your muscles, your central nervous system, and may initially have few visible signs, meaning dili kayo prominent pagdiretso ang signs with your anatomic hemorrhage. See, for example, since internal man iyang bleeding, so see, for example, the bleed padulong sa imong joints. Now, bleeding into your joints will cause inflammation and then therefore cause pain na dayon sa patient. Now, a patient with pain sa ilahang joints will not immediately think na nag-bleeding siya. Di ba? Dili man dayon na mo atong mahuna-hunaan ko. Magsakit atong tuhod, dili man dayon bleeding ang isa sa atong mahuna-hunaan. So, muna siya nga dili dayon siya as in visible ang iyahang mga signs. Now, these anatomic hemorrhages example ana niya is kanang mga recurrent or excessive bleeding after a trauma like dental extractions or some surgical procedure. Now, what are these signs? Unsa may mga signs nga imuhang makita which could probably indicate nga naa kay hemorrhage defect or kana hemostatic defect. So one of that is you have your purpura or the presence of your purpura. Pag multiple na gani kaayo or pag prominent na kayo, na kag makita nga